Welcome back to Therani, I'm Joe B. Today I'll show you the hip precautions that your patient needs to adhere to after a posterolateral hip replacement. Let's dive in. Hip precautions are normally prescribed and needed to adhere to for 6 weeks as it fosters proper healing of the surgery and reduction of hip joint dislocation. After a posterolateral approach total hip replacement, the patient is not allowed to flex the hip more than 90 degrees, which means no bending forward while sitting in the toilet, no pulling the blankets at night while in long sitting, and patient also cannot perform a seated march. The patient is also not allowed to pivot outward or inward, and is also not allowed to cross the legs beyond midline. The surgeon has the ultimate ability to wean patients sooner or later this protocol. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.